Hello guys, and welcome back to Anatomy and Pathology. In today's video we will be taking a look at a disease process known as Ewing sarcoma. Ewing sarcoma is the second most common primary bone cancer after osteosarcoma. In this video we will be taking a look at its prevalence, diagnosis, cause, symptoms, treatment, and of course its radiographic appearances. Let's dive in. In terms of age and gender prevalence, Ewing sarcoma is most commonly seen in those aged 20 or younger. Among that demographic, children and adolescents are most commonly affected. On average, males have a 20% higher chance of developing Ewing sarcoma, and in terms of anatomical sites, the pelvis, long bones, and ribs are most frequently affected. This does not mean, however, that Ewing sarcoma cannot occur at other anatomical sites. The exact cause for Ewing sarcoma is unknown. However, we do know that in most Ewing sarcoma cases, there is a genetic fusion of the EWSR1 gene and the FLI1 gene, which goes on to form the EWS-FLI1 gene. This genetic fusion is seen in the genetic makeup of 85% of Ewing sarcoma cases. Let's take a look at the typical patient pathway for a Ewing sarcoma case. The patient will most likely present with local pain in the affected area. There may be other associated symptoms such as fever and inflammation or swelling around the affected site. These symptoms occurring in our age demographic highlighted area could trigger clinicians to raise the possibility of a suspected bone tumour. This is even more likely if the patient did not present with any traumatic injury as the cause for their presentation. The patient will then go on to have an X-ray, which is likely to show an aggressive bone lesion just like the one we can see circled on this knee X-ray here. We will go on to look at these radiographic features a little later in this video. A biopsy will then determine the genetic makeup of the bone lesion. As mentioned previously, a genetic fusion of the EWSR1 and FLI1 gene is likely to be seen if this is a Ewing sarcoma lesion. Further imaging will then be performed to help aid further treatment and staging. These results are likely to be discussed in an MDT meeting, whereby a group of trained clinicians will be able to guide this patient's onward journey. We are now going to take a look at some radiographic features of a Ewing sarcoma tumour that you may see on a radiograph. Here is the knee X-ray that we saw earlier in the video. We have circled the area of interest, which defines a concentrated area where the Ewing sarcoma lesion is present. We can firstly see the cortical disruption on the outer edges of the proximal tibia. More importantly, we can see these outer areas of the bone to be very fuzzy and not well defined. This is indicative of a periosteal reaction and what we call a sunburst appearance due to its visual appearances. This sunburst appearance is a term used to describe the periosteal reaction, and it occurs as a result of the lesion growing too fast. This characteristic appearance is very closely related to a Ewing sarcoma tumour or an osteosarcoma bone tumour. Finally, we can see that the area of interest appears very sclerotic in relation to the rest of the bony anatomy that we can see on this radiograph. This is highlighted by the focal white area within the affected region. Let's take a look at another example of an X-ray which demonstrates a Ewing sarcoma lesion. This time, we are looking at an AP shoulder projection, and our focus point is the metadiaphysis of the humerus. We can see a triangular looking appearance on the lateral aspect of the proximal humerus. This appearance is known as a Codman's triangle. This appearance occurs when the rapid growth of the lesion causes the periosteum to lift off the bone and does not allow the periosteum to lay down new bone. We can also see within our circled area of interest that we have a lobular lytic lesion, which is of a different density to the rest of the humerus. These are all characteristic appearances of a Ewing sarcoma or an osteosarcoma. We can only say which one it is for sure once you compare the X-ray findings with the histology reports from the biopsy. We are now going to turn our attention to some treatment options that will be available for a Ewing sarcoma tumour. The treatment options that are used are heavily dependent on the stage of the cancer. Chemotherapy will often be the first form of treatment that is prescribed in an attempt to kill off the cancerous cells. As Ewing sarcoma occurs in the younger population, radiotherapy is avoided if possible due to the radiation risks that are posed. Surgery may be used in order to resect the tumour and remove it completely, or as much of it that is possible. Sometimes a chemotherapy and surgical joint approach may be used. Lastly, you may also see surgical excision and orthopedic surgery of the anatomy where the lesion has developed. This would often be a last resort if chemotherapy or resection is not feasible. We can see the results of a surgery involving orthopedic intervention of Ewing sarcoma in this radiograph here. Thanks for watching guys, we have reached the end of this video. If you like this video, please don't forget to like, share and subscribe, and see you in the next video.